A new NHS video featuring young people with long COVID has been produced as part of the government's fresh attempt at persuading young people to get their COVID-19 vaccine. The video features two women in their early 20s, Megan Higgins and Ella Harwood, sharing their harrowing experiences of suffering with long COVID. Megan Higgins explained in the film that despite it being 8 months since she tested positive for COVID-19, she can still hardly walk around the shops without getting exhausted. With only 63.7% of those aged 18 to 24 having received their jabs, officials are hoping that the story shared will help encourage young people to get their jab. Joining me now is Dr. David Strain, member of the NHS Long Covid Taskforce and the British Medical Association's lead on long COVID, and Sammie McFarland, CEO and founder of Long COVID Kids, and also a member of the NHS Long COVID Taskforce. Sammie, I wondered if I could start with you and ask, what your first reaction was watching the film, because, of course, this is territory that you're all too aware of already, isn't it?
Yes, thanks for having me. The advocacy groups, Long COVID SOS and ourselves, have both been campaigning for an awareness campaign explaining how long COVID affects young people, in the hope that it would encourage people to change their habits and to consider the vaccine.
Do you think that people have, I don't know, all the airtime gets taken up with COVID, doesn't it? Have you got COVID? Have you not got COVID? Have you done your test for COVID? Have you done your PCR test? And actually the discussion about long COVID is way down the agenda when it comes to our focus. Is that because we know so little about it, because it isn't actually such a big thing? Or is it something that, once we stop panicking about the actual virus itself and catching it, we'll start to understand the sort of terrible repercussions of what it leaves behind?
I think there was a necessary element of firefighting at the beginning with COVID infection, and the priority was there. And now, really, we're in the pandemic after the initial pandemic of seeing the aftermath of infection. And we do know quite a lot about long COVID in as much as there's a lot of research now, but we don't know mechanisms, we don't know how to treat it. And certainly it isn't a small problem. There's over 2 million sufferers already, and we know that there's going to be more. So every time there's infection, the numbers of long COVID is going to go up.
David, tell me a little bit about what we do know about long COVID.
Yes, thanks, Mariella. It is a disease that seems to be affecting all ages relatively evenly. There is a slight discrepancy in the age, so that there's a slightly higher presentation in the older population, but it's only very, very small difference. It seems to be affecting women more than men. And it's affecting people who are previously fit and healthy just as much as it is with other disease. In fact, the only disease so far that's been identified that seems to be associated with it is asthma and eczema and those sorts of autoimmune atopic diseases. That makes us think that this is part of our body's response to long COVID that just hangs around and continues activated and continues giving, as those videos demonstrate very nicely, these aches and pains, this fatigue, this tiredness, the brain fog. We haven't really scratched the surface of it yet. The coding within GP networks is not there yet, mainly because until there is something to do about it, the GPs have to focus on dealing with the patient in front of them, rather than just making sure that all the digital coding is in the right place.
Obviously, there's a lot of emphasis at the moment on young people getting vaccinated. Is this, do you think, one of the ways to compel them to do so? Because, so many of them are getting, anecdotally at least, getting, are testing positive for COVID, but showing very few, if any, symptoms at all. But perhaps that's disregarding the possible damage that might be done in the longer term.
Absolutely. The rhetoric has always been that COVID is killing the multimorbid, it's killing the people who are the more mature, the older population, and actually the young people seem to get off scot-free. But what we are seeing more and more is the 18 to 20-year-olds presenting to us in the long COVID assessment services. The numbers are going up, and it is having a lasting damage going forward. And therefore, anything that we can do to encourage this population from to get vaccinated and therefore not get long COVID is going to be beneficial for them personally, as well as reducing the transmission within the community.
Sammie, the stories shared in the video were really quite shocking. Do you think that young people need terrified into getting vaccinated? Because the point of the video is very much to get young people, to prompt them into getting vaccinated. It's funny because they do seem to divide into two categories: the ones who are desperate, eager. I mean, my daughter's gone off this morning, very, very keen to have her vaccination, really excited that she now qualifies. But I think there are lots that don't feel that way at all.
I think, from our point of view, the video could have been stronger.
Stronger?
And I think that generally, there are so many symptoms of long COVID, and many were not covered in the video. And I do think that young people are exposed to things in the media all of the time, which are stronger. So we definitely would have liked it to have been stronger.
Oh, really? So what would you have liked to have seen in the video? What would you like them to be saying?
I think they could have shown a wider range of symptoms. They could have shown some of the physical symptoms that that young people are experiencing. And I would have liked to have seen younger people in the video as well. We have children in our group right down to the age of 7 months old with long COVID. So really, why weren't younger people featured? I know that the vaccines aren't available to the majority of young people, children yet under the age of 16. But, we hope in time that will be optional, that parents will have that choice.
David, just finally, although this messaging is, as we've said, very pro-vaccination, there are still risks that come with receiving the vaccine. What are those risks, and should young people be mindful about them when they're making their decision?
Yeah, so the one risk that goes with the vaccine for the younger population is this myocarditis. It's inflammation of the heart. It is incredibly rare. So in a population aged 20 to 22, a very fit, healthy population, 2022, the rates were about 4 per million. So if you then, even if you double that rate, in our young population, what we'd expect to see is no more than 20 cases and probably around 10 to 15 cases across the whole of the UK. Now, myocarditis from the vaccine in the vast majority of cases is self-limiting. Couple of paracetamol, it gets better on its own, and it just makes people feel a bit under the weather for a few days. For the population who are left with long COVID, they are sick for months and potentially even years going forward. So balancing up the risks versus the benefits, there is this mild complication that gets better on its own versus a disease that we still don't know the details of or how to fix it.
It's funny, isn't it, though, or not funny at all, how nervous young people are about getting the vaccination. I mean, despite the fact that, the 4 in 1 million young people might be in danger, where do you think all of the pressure on them comes from to fear it?
It's social media, I'm afraid. One of the problems is to get good, accurate data about the vaccines. You need to start looking up the journals. You need to go through some, let's face it, very dull and boring government websites. Whereas if you turn to Twitter, you turn to Facebook, Instagram, TikTok, it's rife full of misinformation, stuff telling you everything from Bill Gates is putting microchips into you to this will make you go infertile. None of that is true, but it's all widely there in these unregulated social media. So opportunities to talk in stations like this where it will be picked up and the message can be propagated that this is the right thing to do and this is a very safe way of protecting yourself and your loved ones is really welcome.
Thank you both very much indeed. That was Dr. David Strain, the British Medical Association's lead on long COVID, and Sammie McFarland, CEO and founder of Long COVID Kids.